uploading this. Hopefully, does that work? Can all see the slides? Are they up yet?
Yeah, we can see those.
You can see. Super. Okay. Thanks a lot, Carrie. Yeah. So hi, everybody. I'm Jude Boyle. I'm commissioning manager for carers. I work at Derbyshire County Council. I'm also representing my colleague from Derby City Council, who sadly can't be here today. He's sunning himself somewhere. So just to introduce my co-pilots, co-presenters, my esteemed colleagues that know a whole heap about carers. So Emma, could you just introduce yourself, please?
Afternoon all, I'm Emma Beeston. I work for Derbyshire All Age Carers Support Service. That's part of Derbyshire Carers Association. I run a project called Carers Voice, which is where we go out and speak to carers about what they would like support to look like and what challenges they face, so that we can do our very best to support carers across Derbyshire County.
Thanks, Emma. Okay, Lynn, please introduce yourself.
Thanks, Jude. My name's Lynn Dunham. I work for Derbyshire Healthcare Foundation Trust, and my job title, part of what I do, is I'm the carer involvement lead at the Trust. So I work across our services, supporting staff, working with carers, listening to different perspectives and views, and trying to improve the way we work and the way we support carers.
Absolutely. Thanks, Lynn. And Nikki.
Hi, I'm Nikki Crompton. I work for Universal Services for Carers. We are the carer support service in Derby City. My role there is community engagement and peer support. So I go out and try and tell people about the service, try and promote Think Carer, and also run some peer support groups.
Okay, thanks, Nikki. So just moving on to the compelling business case. So you're here because you must be interested in helping us build a carer-friendly Derby and Derbyshire. But I just wanted to sort of set the scene really and talk about why it's so important to do that. So first of all, the prevalence of carers. We've got a whole heap of carers. In fact, in some areas of Derbyshire, we've got higher than the national average number of carers, and we take those figures from the census. And although the number of carers from the last census went down, the number of hours that carers provide went up. So we've got a much bigger cohort of carers now providing over 50 hours of care a week. So you can only begin to imagine the toll that that takes on an individual as a carer. So we want to build a carer-friendly footprint, if you like, because we think that that's working towards a compassionate, resilient society that's going to be prepared for big demographic changes going forward, aging populations, complex health needs, etc. The economic argument is compelling, really. The value that carers bring to the system, if you like, to our local society. They're propping up the health and social care system effectively. The combined worth of all unpaid carers adds up to outside of what the NHS is sort of equates to. There are some figures that have actually been worked up where it's something in the region of £2.5 million a week that our carers in Derbyshire deliver, and about 700,000 to the value in the city. So the carers are saving the nation, the national economy, billions really, and collectively represent the biggest provider of care and support. I touched on the impact that caring has. It's actually a social determinant of health, which means it can be bad for your health. So the broad economic and social circumstances combined sort of influence the health throughout the life course. I think somebody's mic's on. Sorry, can you just make sure that everybody's mic's off that's not on the panel? So I can hear. And actually, there was some research that was carried out that said that if you're a carer, you lose up to 18 days of full health each year. And we know that carers can experience really poor physical and mental health and have health needs of their own. The next point is the better outcomes. So we feel that, and we know that often people that depend on care and support, that draw on care and support, are more likely to receive consistent, compassionate and safe care from family carers, from their loved ones, and also keeping carers well and healthy can sort of reduce the need for formal support from the health and social care system. So it's better outcomes all around for sort of the individuals, the carer, and the sort of the wider health and social care system. We want a fair and inclusive society. Millions of carers work and provide hours alongside full employment, and this can affect many carers that are working and trying to keep the wheels on with their caring role as well. Many groups of carers go undetected: mental health carers, carers from BME communities, male carers. So there's a variety of carers come in all shapes and sizes and all walks of life, and so they often face additional barriers, particular groups of carers. And just as I mentioned, just future-proofing society. We're all carers in one way, shape and form. Most of us will have been carers. A lot of people on this call will be carers or likely to be carers in the future. So it's not a them and us. This really is a movement to try to ensure that we're sort of future-proofing that carer-friendly approach, because we're all going to possibly be in those carers' shoes at some point. So it's crucial really for society, economy, nationally and locally. So hope that's kind of set the scene, and just moving through now, we just want to look at, we've got a lot of care insights from a variety of sources, and our Joined Up Care Derbyshire engagement lead is always compiling those. We want to keep those in one place about what carers have told us, so we don't have to keep asking carers the same things. But I just wondered, Emma, can you tell us a little bit about what your findings have been when talking to carers?
I think what is always so apparent is that carers are experts. They're experts in what they do, frankly, in the toll that it can take on them and their relationships, and crucially on the person they support. And if there's a single ask from carers, it is always that they are given the respect they deserve because of that difficult and demanding role that they provide in looking after or supporting a loved one. Language is constantly raised as a key aspect of how we try to reach carers and what's important to them. Many don't use the word carer. Many wouldn't talk about caring. They just talk about helping and supporting. And if we are going to engage effectively with this vital element of society, then we need to respect and be responsive to that. I think that's particularly important once we start talking about young carers and young adult carers. Derbyshire All Age Carers Support Service can support anybody looking after a family member or friend or neighbour who relies upon them for that support because of ill health, disability, frailty or age or addiction from the age of 5 years. And therefore, the relationship that that young carer might have with school, are they supportive? Do they make reasonable adjustments? Do they act upon the realisation that this individual might be a young carer? Or does it just sit on a form somewhere and not change very much? Becomes absolutely crucial. Are we trying to engage that young person with language that they might recognise? If they don't call themselves a young carer, what do they call themselves? Can we reflect that language to make them feel that we can provide the sort of support they need? And crucially, if that young person has support needs themselves, can we make them feel confident that support is still out there, that you can still be a carer, even if somebody is caring for you? Because at the end of the day, these are real people living in real families with all of the dynamic complexities that that engenders.
Absolutely. Nikki, have you got any insights?
I'm just, again, For us in Derby City at Universal Services for Carers, we support people that are over 18, caring for those that are also over 18. But outside of that, the commonalities stop, because carers come to us with such complex and multifaceted and very individualized stories. And so there are as many backstories as there are carers, there are as many challenges as there are carers. And the carer services in the city and in the county listen to those and see how they can help. They may come with issues around access to services. They may come because with issues with the cared for, with the diagnosis, with medical professionals. Any of those things are very, very common. It's very widespread that carers will tell us that their job is rewarding and they wouldn't have it any other way. But that doesn't detract from the fact that it can be tough, and the support that is out there is very much needed. A lot of carers will come to us with needs that are financial. We are part of Citizens Advice Mid Mercia, which puts us in a position where we can access benefits advice, debt management, other income maximisation. And I know there's a similar structure in the county where carers can access through Derbyshire Carers that financial advice. So if you're in a pickle, or if you just need to know how can I support myself better, your carer support services can do that for you or help you with that. You may be that you're surviving just on carers allowance, or you don't even know how to get carers allowance. Or it may be that you're a pension and you don't know if you can get anything else. So it's very, very common for finances to be a huge part of what we see with carers. But it's important to note that carer services are all free to access. So accessing a carer service can help you to have a look at those finances, but can also, it doesn't have any negative impact because they're free, paid, supported by your local authority.
Exactly. Thank you. Lynn, anything to add?
Yeah, just a couple of things. I don't work for Carers Support Services. I work for an NHS trust, and carers do step forward and work with us and speak to us about what matters to them. And I suppose a couple of things from me is they talk about their health and well-being. They talk about opportunities for them. They talk about the feeling so overwhelmed at times and not knowing where to go and not knowing who can help. They also talk about their fears for the future. They talk about what's going to happen if they're no longer able to care, and they carry that with them a lot, particularly sometimes as they age or they have their own fragility or their health and well-being is impacted. They also talk to us a lot as well about mutually caring relationships and how complex, you touched on it earlier, about how complex relationships in families can be, where one person may provide care, something may happen to somebody else and they provide care, there may be another family member with needs, and this is really complex, and sometimes they're making really difficult decisions about whose needs are highest, so how do we best care? So lots of information. Yeah,
absolutely. This resonates. We were just talking to carers yesterday, Emma and I, and it's just kind of all squares. This issue around care identity and status, it's been absolutely paramount. We're putting together the carer strategy, which I'll just touch on later. But this is I don't think I've ever known it to be this kind of key, really, about terminology and the status of carers. And I think, it seems like the big issue at the moment. Nikki, have you kind of
we hear regularly about the use of the word carer. For a lot of people, it evokes a picture of somebody that's coming in a uniform from an agency, and I don't think anyone's found a nice neat solution to split those two apart. But obviously today we're talking about unpaid carers, those friends and family that are helping somebody because they can't do 100% of everything themselves because of their own health or mental health or addiction or a disability, whatever that reason is, that means that they can't cope completely by themselves and there's somebody else in the background. For us, that's a carer. So that carer may just be coming and playing a game of cards with their gran, and they're getting that social interaction, and we would deem them at the carer services, we would deem them as a carer. We will support people right from the start, right up to those really complex situations where people are doing lots of different things for the people that they care for. But what we also see around that language is people not recognising themselves as carers. And that's the biggest barrier that we can find, I think, for people accessing support services is not thinking of themselves as a carer, because I'm a mum, I'm a wife, I'm a grandma. Whatever that pre-existing relationship is, means that perhaps you don't instantly reach for that identification as a carer. And so it's, whilst the language is important and we don't want anybody to be getting upset by that, what's more important is that people understand that that support is out there for you, and we would identify you as a carer just because that means you can get help.
Emma, we were talking yesterday, weren't we, about some of this to substitute words, if you like. And I know you've been working through that with carers about alternative phrases.
I think Nikki is completely right. There is no perfect agreed phrase that everybody who may be supporting a loved one tends to draw on. And actually, I think that's why it's so important that services consult with their service users and use reflective language wherever possible, so that we are making people feel as comfortable as possible to engage with a service, and respecting the fact that they are the person in a given situation. And so actually how they choose to describe it is the terminology that we should seek to echo. That doesn't in any way undermine Nikki's incredibly important point that carer is a word that provides some legal protections, that has real power. However, it's also a word that can be liable to mistranslation if English isn't your first language. It's a word that takes people usually several years to come to terms with as describing their relationship with a family member. And it can also be a very othering word. Most recent statistics suggest that at some point in our lifetime, 2/3 of us or more will support and look after a family member. And yet, if you approach a meeting that might have carers represented and might have professionals there and might have some medical experts, we tend to enter that meeting with those hats on. Are carers something other or something separate? They're not. They're a crucial part of society, the society that we are all part of, and many of us will be carers at one point or another. So, I mean, some of the sort of words and phrases that have come forward are help. That's particularly popular with many of the young carers that we've spoken to. Look after, support, empower. But crucially, it's constantly trying to listen to what carers are telling us and to evolve further our understanding, and to remember that it's not them and us, it's all of us together.
Absolutely. Yeah. Just moving on to the next slide. Lynn, I'm going to bring you in here, because what we hear so much from carers is about giving respect and being treated as an equal. And I know the triangle of care is the chosen method, the model, if you like, to drive that recognition and parity for carers. Can you tell us a little bit more about this, please?
Yeah, absolutely, Jude. I said earlier, I work for Derbyshire Healthcare Foundation Trust. So for anyone who's not familiar, we deliver mental health adult and older adult services, mental health inpatient services, substance misuse, learning disability children services in Derbyshire. And we spread right across for some of those services across the city and county. So we're quite sort of big geographically. We recognised a number of years ago that we really don't have the right things in place, and we got an opportunity to join a membership scheme run by the Carers Trust, and this membership scheme is called Triangle of Care, and you'll see the picture in front of you. It recognises this triangle where service user, professional and carer all work together for the best outcomes, which again, what Jude touched on earlier, we're looking for better outcomes for everybody. In a nutshell, what the scheme does is set 6 standards, and it asks us as an organisation to embed these 6 standards into our teams and services. So I'll quickly run through what they are. Number 1, that carers are seen and identified as soon as possible. So, you know, we can identify people, but not necessarily as a carer, even though that term is, you know, controversial at times. But we must see that people have got caring responsibilities. Once we've recognised that, we must make sure that we've got all the right protocols in place about information sharing, and we understand how to manage information and share wherever we can, but respect people's rights to confidentiality as well. We train all our staff. All our staff must have sort of training in care awareness and care engagement. We must provide a range of information across people's journey through services. So as people step in, they'll need to know about carer support services plus other offers available to them, and that we share that. And we also know how to direct people to the services offered by Emma and Nikki today, and we can create that bridge from the NHS across to sort of dedicated and commissioned carer support. So we have these standards. We ask our teams to embed them across services. And if you like, that creates a framework for us, and we can measure whether teams are doing this. We've got to have something tangible. We can't just say, we'd like to work in this way, it's a good idea. We have to be able to measure what we're doing. And that is done. And that information, once we've checked our teams and services how they're doing, that goes back to the Carers Trust, and they put their sort of eagle eyes on it, and they decide whether they think we can sort of continue this work, and that we're up to scratch, really, which is good. It's a good thing. We're under scrutiny. What that framework does is our way of trying to make sure carers are seen, they are valued, they are supported, and they are involved in the care of their loved one. We do have some other measures in place as well which support this, because really Carers Trust are looking for a shift in culture. They're looking for our organisation to really embrace the idea that carers are partners in care. We have monthly carers engagement meeting where we'll sort of collaborate with our partners and with carer representatives who step forward. And this is where we can thrash things out and look for ways to sort of continue building on what we're doing and make improvements. We also have a carers lead at Trust Board. And she sort of will represent that sort of perspective and make sure that that's stitched into the conversation at higher levels. And we've got carers champions in all our teams and services, and they're the nominated person who sort of is a bit of a cheerleader, really, and spreads the word, spreads the information, and understands what's expected of everyone. So, you know, I can go into more detail if people want to know more, or you can Google certainly Triangle of Care, because a lot of trusts like ours are members of this scheme. It's well understood as the sort of gold standard, really, in how we should be adapting and making sure carers are part of all our conversations.
And carers feel this has made a difference, don't they? The carers.
I think it's hard to measure whether it makes a difference, but we see evidence of it. Okay. We see evidence of people sort of embracing new ways of thinking and working in different ways and asking more questions. It's a journey, Jude, and we're not perfect, and we don't claim to be perfect, but we are setting out on that journey, and I have seen in my time a continuing of a commitment towards this.
It's that cultural shift, isn't
it? Yes. Yeah.
So thank you for sharing that. And as you said, the Triangle of Care, it's a model that can be sort of transposed in any organisation, can't it? It's not. It started off in. Sorry, what was it? Healthcare.
It started in mental health.
Mental health,
Yeah, it started in mental health, but they're trialing it, piloting it now in social care. We've got private providers who are members of the scheme. Yeah. So if you look at the standards, they pretty much stand up whatever service you deliver.
Yeah, exactly. Yeah. Thank you for sharing that. Okay, so just moving on to another pillar, really, of a carer-friendly society or footprint is effective carer support, and it sort of fits in well with what carers have told us and what we see, really, and what's a sort of effective support solutions, if you like. So kick off with Emma. If you could just kind of share your observations, please, Emma, about what you think works well in supporting carers.
I think a multiplicity of routes to support is always crucial. Carers are individuals. Every person's ask from a support service, every person's need for support is going to be different, and it may differ at different times. Some carers will be very confident using technology and would really benefit from opportunities to engage with services out of hours. Others will need and want an in-person face-to-face opportunity for support, and to try and respond to that, we offer a multitude of different routes to support through Derbyshire Carers Association. We have support groups, we have a helpline, all the way through to a formal carers assessment. But crucially, that support needs to adapt and evolve in line with what service users tell us is effective. And that, I think, is where the Carers Voice programme and other consultation and co-production opportunities is so crucial, because it allows us to respond to what carers actually need and actually value, rather than what we sitting in a box might think is helpful. And that's an ever dynamic and changing picture.
Exactly.
Very crucially, we know there is work to do to improve access to support for all, so that carers who might have additional support needs themselves, who might be from a minority group, or who might be from a group like male carers that traditionally are less likely to seek support, know that there is support out there for them, can see that this is a service for them, for everybody, regardless of circumstances. And crucially, it's not just a question of direct frontline work with carers, as important as that is. We've talked before about how carers are part of society. They are anyone, everyone, they are all of us. And therefore we need to build those professional relationships, the relationships with partner organisations, and crucially, in partnership and in alignment with the triangle of care that Lynn has talked about, with frontline health services. Because for so many, the GP or the hospital will be that moment of first diagnosis for a loved one, and therefore actually the first moment to identify and institute support for the carer. And with that in mind, we have carer awareness training for frontline staff. We have a GP liaison worker working with engaged practices to look at, can the practice team signpost and support carers effectively. And we also have our H Connect project working in partnership with Triangle of Care in hospitals. There's always more to do.
Absolutely. That was a great run through there. Lynn, what have you been, what carers said to you?
It's not dissimilar really. When you think about effective carer support, for me, our staff coming along, understanding a little bit more about the expectations on them and also the needs of the carer. And I think having that sensitivity to just take a little bit of time, and this is something carers talk to us regularly, is just taking 5 minutes. Sometimes carers present with the person they're caring for, and sometimes they don't. But in whatever route that may be, just taking a little bit of time to listen to what that carer is saying, to listen to what they are most worried about, what support they need at that time. And again, already touched on, but everybody's experience is different and everybody has different needs. But hopefully we've got the right mechanisms and support in place to make sure that we can respond to that. So it may be that a carer is suggesting that they'd welcome some type of group, they'd like some type of training, or they'd like something else. And we can sort of create a situation where we know how to get them to where they want to be, and where they can get the access to that support that they want. But from our perspective as an organisation, it's not a blanket approach, but we really need to see them first off. Sometimes we're the first people they might come into contact with in terms of healthcare provision, and we need to recognise that, identify them, stay with them as their loved one journeys through services. Stay with them, keep that contact up, involve them in that journey. That's one of the things they sometimes speak about most, is being kept in the loop, understanding they
Yeah.
can be the person that's getting somebody to an appointment, that's making sure that they've
Exactly.
got medication and taking medication. So keep them in the loop as people journey through, and
Yeah.
always keep reminding that carer support is there and available when they're ready to reach for it or think it's going to help and make a difference, that they can do that. As we touched on earlier, recognizing that you have needs as a carer is a big step, and that there
Yes.
might be
Yeah.
things out there for you that are going to help, but taking that step where you see that is quite a big one for people.
Yes. Yeah. Yeah. Very often carers put themselves, don't they, on the
Yeah.
sort of back burner, really, where they're trying to sort of prioritise the health of the person, their loved one. But
Yeah.
it comes at great personal cost, that. And what you've described, some of it is this is low cost or no cost even
Yeah.
cultural approaches that have paid dividends, don't they, for carers?
Absolutely,
They
Jude.
really do.
Yeah.
Yeah. Nikki, anything to add?
Well, I mean, just listening to both Lynn and Emma and thinking, you've got the main strands there of that individualized approach, as much as
Yeah.
can be achieved within an organizational setting, the listening and the responding, whether that's to an individual or to a consensus, it's been important. And I think that we're lucky in Derbyshire and Derby City that our carers services are small and agile enough to be able to respond to that. And an example of that we've created recently, typically, historically, we had access predominantly through our helpline, and that was either email or by phone. There was always somebody out and about doing something, and we have lots of events on. But we've trialled over the last couple of months what we're terming a carers hub in Mackworth, where once a month 2 or 3 of our staff are available for carers to walk in. How that's helped is that carers that don't want a fixed appointment or perhaps can't pick up the phone, because sometimes that can be a bit awkward, talking in front of the person that they're caring for,
Yeah.
can be awkward, and it's not ideal for some people. And these people have managed to, carers have found an opportunity to get out the house, and they've got a good chunk of a window to be able to do that. And they've come and spoken to us. And when they've done that, it can be often, it's never very straightforward things. They've often got a lot going on, and it's complex, and they've built it up, and like the person that waits until they got 5 things wrong before they go to the GP appointment. And so it's been amazing for us as carers staff to be in that privileged position where we've actually had such benefit from opening up the hub and getting people to come to. We're in the neighbourhoods, but they're coming to us in a neutral environment and finding benefits, and our staff have got massive benefits from it too, because we can see how effective it is and how valued it is to people. And it's added another string to the bow that we didn't realize how useful it would be, but it's been a lovely thing.
Yeah. Sounds really successful, surprisingly so, almost. From that. So another key pillar really is sorry, just get my slides to align. Technical. It is really the support in some of these big institutions that we've got across our footprints in terms of employers, really, employment and education, colleges. There's a lot of advantages, particularly in the workplace, of having carer-friendly policies. We know that around 1 in 7 carers are juggling care and work. About 20% of the carer population report that they have to resign or reduce their hours at work. There are significant benefits for carer-friendly employers, and we think that leads to reduced sickness, absenteeism. You can retain experienced and trained staff, improve productivity, and that practical support that can be offered to individuals to negotiate their hours, allow some flexibility around their caring, keeps the wheels on. They're able to continue to work, which is so critical, isn't it? To sort of your whole well-being, not least your financial well-being. There are things in law, carers' rights in law, that mean that carers can have 1 week's unpaid care a year to carry out their caring duties, and you can ask your employer to work flexibly and have time off in emergencies. Emma, you've been talking to young carers, haven't you, about the difference it can make in a college or a school setting. Can you just tell us a bit about that, please?
I think I've been really shocked that actually the key concern that young adult carers, that's carers aged 17 and a half to 25, have been coming forward with recently, is around the financial impact of caring, but not just the immediate financial impact, the long-term impact. Our young carers point out that missed days at school and college, missed exams, and even if there are multiple people caring within the family, or it is their parents who are unwell, less support at home with their school and college work, are going to have the potential for an impact on their future career opportunities, their future earning opportunities for the rest of their lives. And if we want to empower and support those young carers to have every opportunity that they should be as entitled to as every other young individual, but also if we want to future-proof and support our workforce of the future, then there is more to be done. Young carers who've come forward consistently talk about school as one of the absolutely most crucial influences on their view of being a young carer. School can be one of the greatest supports where reasonable adjustments are made. And it can be one of the greatest anxieties where there aren't. And sometimes those adjustments are really small. It can be giving somebody a pass to take 5 minutes out just for a breather if they feel overwhelmed by what they're doing to support a loved one. It can be being understanding if somebody's 10 minutes late, and even if it is not the first time this week. It can be scheduling meetings, parents' evenings at times that are going to be attainable for that family to attend, especially, for example, if somebody finds it harder to get up in the morning or has obligations to another member of the family in the evenings. That sense of a small change making such a big impact is especially true for our young carers. And I think it opens that question of what can we all do? Because the answer is we can all do something. We can just ask, how are you?
Yeah.
Whether that's with a colleague, whether that's with our next door neighbour, whether that's in a professional capacity within a school or within a frontline service, and the difference it makes to that individual's ability to continue going to school, to continue going to work, to reach out and know what support's out there is undeniable and immense.
Mm-hmm. Absolutely. Yeah. Could you be that person?
Absolutely.
Yeah. Nikki, you were talking about a recent experience, if you're okay to share that?
We were when you are a carer, you may become aware of the legal situation that Jude explained and your rights and what the law tells you that you are eligible for. And you may be really lucky to work for one of the organisations that has enhanced, like UHDB, or I think some of the Toyota and the big manufacturing organisations have better terms and conditions for their employees around carers leave than others. And so you may be in that really lovely position of being in one of those organisations. But for me, I think I work for a carers organisation, so you would hope that they're on that enhanced path. But the reality is you don't know until you're in that position. And I was in the position a couple of months ago when I had to test the theory of whether or not my organisation was a good carer employer. And I'm so relieved to tell you that they were. You were waiting for the test, brother, but you know, I felt supported, and it wasn't in a checking in when you're coming back kind of way. It was we're here for you, and it was my manager, but it was also my colleagues, and I really hope that I can be that colleague, and hopefully you can all be that colleague or that neighbour that understands the carer, that gives them a little bit of slack, and because that's what we all need. I think because things can change overnight like they did for me, and the demands on your life, and your priorities completely change in a heartbeat. And when that happens, you need those people around you. And regardless of what policies there are in place, it's about the people, and that whether or not people will uphold those policies and just make it easier for you. And I'm fortunate that my organisation did make it easier for me. And as I said, I hope that I can be that person for somebody else in the future.
Yeah, glad it worked out for you, Nikki. Lynn, anything to add? Can't hear you, Lynn. Are you on mute?
My apologies. No, I think that really comprehensive,
Yeah.
the way that was talked about. You know, it's important that we recognise it. It's not just about the services we run, but that people have the right support when they're in employment to stay in employment, and it's understood about the demands of caring, and there is some flexibility there.
Absolutely. Okay, so we're just drawing this to the last couple of slides. Health and social care integration. It's what everybody wants, isn't it? And certainly that's what carers tell us all the time, that wherever they find themselves, they want to have the same experience, really, that respect and recognition. And there's, sorry, let me just check my notes. Yeah, we've talked about today, haven't we, the sort of cultural practices and attitudes towards carers, and how carers want those to shift, really, and you know, so many of them are low cost, no cost, but with high impact. There is law that both health and social care work under, which is kind of acknowledges carers. So we've got the Care Act, which was the biggest thing since sliced bread for carers back in 2014, finally giving them parity to those that draw on care and support. That option, are you willing and able to provide the care? And you know, this is something that carers have in statute. You know, that there shouldn't be any expectations around or assumptions about levels of caring. Carers have the right to say what they are willing and able to deliver and provide. Carers can have care assessments, which is kind of the parity with the adult that depends on them, and rights to advocacy, information advice, care of personal budgets. The Children and Families Act that really acknowledged young carers, young adult carers, parent carers, and granted them the same rights to an assessment as children. And the Health and Care Act commits the NHS to consulting with carers about planning and development of services, involvement of carers in decision making, and involving carers in particularly in decisions around the planning of discharge, just when they're discharging patients from hospital. And embedding that sort of think carer really across the piece. So the final kind of pillar really to this carer friendly society, which we're all working on together in the background, which is this sort of strategic commitments. It's a carers strategy that is a system-wide partnership strategy, all age, and we've got on board, we've got the Derbyshire Healthcare Foundation Trust, we've got both Derbyshire Carers and Universal Services as partners, we've got the Integrated Care Board, both of our local authorities, both of the hospitals, and with the voluntary sector colleagues, and we're also widening that membership, if you like, to influencing the development of this. Obviously, carers at the centre of that. We're talking to carers all the time. We've got a working group where carers are helping us to shape this, and where we're set out what our strategic intent is, what's important to carers, and what are the priorities that we want to work on as a system. to improve the health and well-being for carers and the whole carer experience. And we're sort of working on 3 elements really, which is around recognising carers, good quality, effective support for carers, and helping carers to have a life outside of caring. And so that's where we're sort of shaping the design of the strategy. Where in the final draft stage, we should be in a position to share that more publicly, more widely, with around sort of December time, and I hope we can put that on the Derbyshire Joined Up Care Derbyshire sort of Derbyshire Dialogue page, or I think there's a engagement pages on that site as well, for people to have a look at that, and it'll be ready for sort of full launch, if you like, around the springtime of next year, because it'll go through all the governance, which will give it more status and credence really, because all our strategic partners across the system, if you like, and that'll include education, police, Derbyshire Fire and Rescue, they're all going to be partners, because carers are everywhere, and this is a lever really to get that high level sign up to the commitments within the strategy. And there'll be an action plan associated with that, which will be appraising on a frequent basis. We'll have carers at the heart of that, to say what they think, to how we're progressing. We've got to keep it moving, and keep everybody accountable, all our partners accountable, because we see that that's the only way to kind of lever the changes that we want to see, which is going to be beneficial for, like I say, all of us, particularly experiencing that role as a carer through our lives. It's highly likely that most of us will have that caring role at some point. Are there any other things that you want to just finish on, colleagues from my panel? Anything that we haven't covered, or any?
I think we should probably give everyone a chance to grill us, but I suppose it's just that eternal thing, isn't it, of if we all ask ourselves, what can I do to help? Is there something within my role? Is there somebody I know or come across who might be supporting a loved one? And can I do anything? Then that's a real move towards the very carer-friendly society that carers have been saying it is so crucial within the strategy, and is their ask that they are respected, embraced and supported wherever and whoever they are.
Absolutely. Thanks, Emma. Couldn't put it better myself. Perfect. Thank you. So, Carrie, are there any questions for us?
Thank you very much. Very, very good presentation. Thank you very much for coming and delivering that to people. I've just been keeping an eye on the chat. I have popped something in there just to say that if following the session, if you've got any more questions or comments, we've got a bit of a generic inbox that you can send those to, and we'll aim to answer as many as possible through the session today. So I'm going to go through the chat first, and then I'll go over to people with their hands up. So there's a great discussion in the chat, as there always is at these sessions. But one of the questions that we've got here, one of the first ones that was sent in, was around, the concern around the online and move to digital. So is digital poverty and digital exclusion going to be taken into account on a wider basis? And how do we get around some of those reasonable adjustments?
Yes, I don't know if anyone from the panel wants to. Emma? Have you got your hand up, Emma? Yeah.
Yes, I was just going to say it's absolutely a crucial concern, and it's something that we're very mindful of as a service. Carers talk a lot about the retreat behind the computer screen, and I think it's really important to acknowledge that there's carers who might not feel digitally confident, but there's crucially also those who would just prefer to speak to a real person. And carers have talked very compellingly about some of the instances where technology can be a real additional barrier to support. Maybe talking via the computer means that you can be overheard by your loved one, and you might not feel comfortable discussing some of the ways you support them in front of them, because you don't want them to feel like they are a burden, or like you resent the support that's being offered, when actually it's just a question of how can you be supported to support them? Interestingly, we have an ongoing project at the moment where we are working with carers to look at how we can make carers assessments as effective and accessible for as many as possible. And a digital offer may well be part of the solution to that. But part of is the really crucial bit of that statement, because one of the things that's come forward from carers is how much they value the opportunity to speak over the phone, to speak in person, and therefore reinforced how important it is to keep that in-person offer available. So I think that takes us all the way back to the beginning, that every carer is an individual, and there absolutely are barriers, additional barriers to support, like sort of digital poverty, that we need to continue to respond to and to continue to acknowledge. But if we keep talking to carers, at least we know some of where those barriers are, and we can continue to preserve the other routes into support, like the helpline, like our front-facing engagement workers that they really value.
Brilliant, thank you. Just working my way through the chat, there's a great discussion around the word carer and how it's individualised for people. So we get people getting confused by being called healthcare worker and the distinction between that and an actual carer. It's not as a question as such, but more of a theme running through this conversation here around the consistency of the identity of the carer. So I didn't know if anyone wanted to kind of touch on that.
I'm happy to talk to that. I mean, I think Emma said it beautifully early on when she talked about reflecting someone else's language. My experience is we all have kind of slight language triggers, sometimes that irk us a little bit, and that's what we don't want. We don't want to create another barrier, like with the digital thing, element. We don't want to create another barrier for people coming forward and getting to support, being recognised of having those additional things on their plate. And I did read something about somebody that it irked them early on because they were a parent, and I think, yeah, I'm mum, I'm not carer, and so you can completely understand that, and having the compassion and openness to have that conversation and respect an individual's views seems to be important, alongside what kind of my point is that, yeah, it might be an icky word, but if we can get past that and all kind of read from the same hymn sheet about helping, then that and not let that be a barrier. And part of that is listening, part of that is being open to that reflective language, and part of it is understanding that it is a barrier and trying to find ways around it for the individual.
Brilliant, thank you. I'm going to then move on to people that have got their hands up. I'm really sorry, I'm just struggling to see names. I think, Tony, you've got your hand up. Do you want to come in and ask your question?
Yeah, really, if it's a question, the question is, how do you think you can help us? I'm here representing San Diego Friendship Hub, and I want to explain the caring role that we are performing. We've got social prescribers who bring people into us, social workers bring people into us, family members bringing their older parents into us, and we've been labelled as lifesavers for some people. We've got parents who bring in their more elderly autistic children who have no social life at all, who come and spend time to us. We've organically grown. So we've got a room set out as a huge cafe. We've got crafting activities. We do digital inclusion with people. We do community activities and meals. And so we have a large number of people who come to us because they're isolated, they're lonely, they've got problems, and their family members can bring them to us and have a break and go off and do other things. We run for 4 mornings a week. And we're a totally voluntary organisation. We didn't set out to be doing what we're doing now, but we've got quite a number of people with autism who come, people who've got mental health, people who've got addiction, who come into us, and so we're performing quite this carer role for a number hours a week. And I don't think you've mentioned anything like us in the caring thing which you've done, but we could do with some support to help us with the signposting that we might need to do as people come in and I recognise that they may have problems with finances or other issues. So we've become in this position where we've got these people. We might have up to 35 people at a time in our Capri area who are building up new friendship groups and meeting with people outside afterwards. But when we come across the problems, we haven't always got the expertise to be able to refer people on to get the extra help that they might need. So I think we're performing a great public service and taking pressure off of doctors' surgeries and the National Health in many ways with the work that we do. But we need some support as well. What support do you think you can give us?
Do you want me to come in on there? It sounds like you are absolutely a lifeline. Your group and all that you do. So the fact that you're recognising and acknowledging carers, that's that's one of the first pillars we talked about, isn't it? But in terms of feeling that you've got the confidence and the skills to be able to support carers, or certainly make sure that you're signposting them to specific carer support, you could certainly Derbyshire Carers or Universal Services for Carers. It would be Derbyshire Carers anyway, because it's Derbyshire where you are in sort of your location. Would be able to support your group. Would be able to kind of provide that information that you need. Potentially there are opportunities for drop-ins and clinics, or certainly to sort of find out when those drop-ins and clinics are in that your vicinity. So there would certainly be that opportunity to support from the Commission service. Emma, it looks like you've got something to add.
Absolutely, Jude. If you're happy, Tony, either to pop your email in the chat or for Carrie to pass it along after the session, what I can do is put you in touch with our engagement team. The whole idea behind the engagement team is that they are out in the community, talking about carers, identifying carers, but also working with services like the fantastic one that you have talked about today. And we do offer carer awareness training for professionals and volunteers to support you with that signposting and referral path. So that you and your volunteers can sort of feel empowered to support those carers onwards. But as Jude said, it may also be possible to do some collaborative work so that we could have a support worker drop in periodically to some of your sessions, or at least leave some literature so that, again, that route to support is clearer. So yes, please do get in touch. I can sort of put my details in as well.
Okay, sounds good. Thank you.
Thanks,
I was
Tony.
just going to add a couple of resources, if that's okay. There's one that's not geographically specific in Independent Age. There is a website and they have free training, and it's kind of bite-sized training, 30 to 45 minutes. And they will run through certain benefits, perhaps like attendance allowance or carers allowance, and I think pension credit they do. And it may be something that if your volunteers wanted to upskill themselves a little bit to be able to pass on that information. In the city, there's a wonderful project being run by the neighbourhoods team in Arboretum and Normanton area, where they're offering a day's free training for people like you that are running groups like yours, so that you can signpost people really effectively. But Independent Age may be a way of being able to do that, so you're a little bit more confident. And the other place that seems to be quite an effective resource for you is Errorwash CVS. They might be a really nice partner to work with, and so it might be good to see how they could support you.
Yeah, thank you. We do work with Errorwash CVS, and we've also used Independent Age materials, but
Excellent.
we do have children from 5-year-olds who come in with carers, so it's not all elderly people by any means.
I think Derbyshire Carers and Derbyshire All Age Carer Support Service would be an excellent contact for you then.
Yeah.
Okay, lovely, thank you.
great. Thank you so much, everyone. I'm going to bring it to a close there. I don't think we've got any more questions, but as I mentioned earlier, in the chat, I've just put our email address. If there's any questions you think haven't been covered or you haven't had your chance to think about what your question is, please do email us and we'll get you an answer as soon as possible. I just want to say thank you to our wonderful panel and presenters today. It's been a great presentation, and thank you to everybody who's taken the time out of their day to attend today as well. As mentioned, we'll be sharing the links afterwards, and be sure to look out for our next upcoming session, hopefully taking place in the new year now. So once again, thank you very much, everyone, and please get in touch if there's anything we can help with. I'll draw it to a close there. Thank you.
Thank you.
Thank you.
Thank you.